You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about veneers or cosmetic dentistry. With us we have cosmetic dentist Dr. Krauss. Okay, you're the hot cosmetic guy in Bakersfield. Right?
That's right, without a doubt.
Without a doubt. Now people come from long distances sometimes to get their teeth.
Absolutely.
By you? What are the different categories of patients, by the way, that you see? I mean, are younger? Are they getting older and older, younger and younger? With veneers.
We've had patients that are in their early 20s. For example, we had a girl who her teeth were undersized and spaced, and there was no way that anybody was going to do anything without some sort of cosmetic intervention. And so we were able to completely change her life. So somebody that's young, we have people that are in their 50s and 60s.
Yeah, 60s young today. So even
yeah,
60s
is the new, isn't that it? 60s is the new 50, 50 is the new 40, whatever.
So a lot of people getting facelifts, things like that.
Absolutely.
Teeth, finish it off. What do you say to those people?
Well, that goes back to what we were talking about earlier on the show. Somebody who's spent the money and the time they've invested in to make themselves look the best they can. If you're going to spend the time making a beautiful frame, you need to finish off the picture. And
get
the contents, that's right, the contents of the picture are the teeth, because quite frankly, we're social beings as humans. We communicate, and we communicate with our mouths.
Do they smile more, by the way, after it's done? I mean, do they tell you, do they go around flashing smile, their smile?
All over. And this girl I mentioned earlier, her friends and relatives who've talked to me, they say, Dr. Krauss, every time I see her, because they've seen her all her life with the smile she had before, and then when she does smile, she's like, oh my gosh, I just can't believe how good she looks.
Okay.
And they even will thank me. They say, we're just thankful that you did that for her.
All right, how much say-so? Let's go to the process. How much say-so do they have? Because it seems my fear, and I don't know if this is a common fear, is that they're not going to like the finished result of these veneers. So how much say-so does the patient have, and how do you decide what they're going to look like? And do they get to see them somewhat before it happens?
Yes. Yes to all of your questions. Okay. And that fear is absolutely a grounded fear. In other words, they have every right to feel like that, as I would or anyone else.
So on day one, they sit down with you, they tell you, this is what I hate about my smile.
That's right. I sit back, first of all, before I can help somebody, I need to know where they're coming from. Okay, so the first step one in the process is you come in, and as the name implies, smile design. The first thing we do is we talk about what it is you dislike about your smile.
Do they ever bring pictures in of a movie star? Or?
Yeah, absolutely. And
say, I want that.
And bear in mind, let's say you have an older person who had a prettier smile when they're younger, and we encourage them, if they can, bring us some photographs of yourself when you're younger.
Okay.
And yeah, sometimes people say, yeah, I want to look like that. But the thing is you need to sit down with people and you need to explain the process to them. Everyone wants to have a beautiful, natural smile. They don't want anything that looks fake.
So that comes up. They say, I don't want it to look fake.
I would say almost...
Veneers seem so big, by the way. They just seem big.
But they don't have to.
They don't have to be.
They don't have to be big. And
so that's in the hands of the dentist. Is that?
That is in the hands of the dentist, and working with his lab person to make sure. The thing is that if my signature is going to be on some work that I do, I want it to be... You sign behind the teeth? Yeah, if I have to, I'll sign behind the teeth.
You have to.
Okay? Once I'm done with the patient and they're out there living their life, I don't want them to have any remorse, regret. I want them to be happy. Their smile sells what I do. Okay? I have not just...
So you get a lot of referrals?
Absolutely. I've not only helped them, but I've helped them to reach other people who now want to come in and do something about it. Okay.
Now with veneers, so now you have rapport, like you say, you know what they want. Now how do you show them what you're going to do for them?
I involve the patient in the design process. Now the thing is if I go to anybody for any kind of specialty work myself, I obviously am not going to know everything there is to know, and it's their job, as it is my job, then to work with them and educate them.
What makes up a good smile? Is that what you're telling me?
Right. I mentioned earlier in the show that there are things that we look for that have to do with each individual's, like I said, the shape, their skin tone, the shape of their face, and all of these things have to be taken into consideration. Their smile line, how broad their smile is. So in other words, how many teeth are going to show, the shape of their
Julia
arch.
Roberts has a big, broad smile.
She has a big, broad smile. I don't have a big, broad smile, okay? So all of these things have to be looked at and taken into consideration. Those help us determine how long should the teeth be, how wide should they be. I mean, even though we don't take these little details in consideration, we look at a nice smile, we automatically...
Can't put your finger on it, but...
That's right. You automatically in your mind says, that's a nice smile. That looks good.
Okay.
It's pleasing to me.
So you don't want it to go noticed then? Just that it looks great, looks pretty.
I want it to be sort of under the, kind of behind the scenes. So in other words, it's not going to stand out as not being a beautiful smile, but a lot of my patients are going to get comments that they have a nice smile.
Okay.
Okay. So
do you show them something on imaging, or do you show them catalogs of examples of what smiles can look like?
We do both. We have images that we can show them. Okay. We also have catalogs, and I'll actually go through the patient and say, look, these are the different shapes. And people are actually amazed that there's so much variation.
Oh, you say that there's a masculine smile, there's feminine smiles.
That's right. That's right.
Based on the shape of teeth?
That's right. You can, masculine teeth, there's definitely a look. For example, the two front teeth are generally going to be a little bit long, without getting in the details.
A little longer?
A little longer. Feminine teeth have a different look. There's a little softness.
Like curves,
the lines.
almost?
That's right.
Okay.
That's right. So there is a difference between how the shape of men and women.
Is your goal not to make it perfectly straight across? You want to make teeth a little bit?
You know, my job, yeah, that's right. If you're not careful about what you do, then you're going to create a smile that looks artificial and doesn't fit that patient.
Almost. So perfect.
That's right. But there again, if somebody knows that they're doing dentures, you can make dentures look good. But you need to know what you're doing, and you need to know it needs to be engineered and designed to fit that individual.
Do you make dentures, by the way? I mean, do people come to you for dentures?
Yeah. I mean, it's
that are real, that look.
Well, you know what? All procedures that you do in cosmetic dentistry relate back. How does it look? How does it fit the individual?
Okay.
So if you're making it, whatever it is you're doing, you know, implants with dentures or implants, you know, restoring natural teeth, whatever it is, you have to do it with the end in mind.
Make it
How is it going to look?
Now, not to rush ahead here, but we are, you know, close to almost out of time.
Okay.
But okay, so they say, I want that smile. You've decided you could do that for them in a catalog or with imaging. What happens next?
Once we've made the decision, you know, what they want for smile, we do a couple of things. One is, if I may throw another thing in it, the smile, the teeth themselves are, you know, one element. Remember, there's the gums too. So we're going to be looking at everything. We're going to be looking at what's going on with the gum tissue. And the reason why I just want to stop and go back to that for a minute, we're not only going to be concerned about constructing beautiful teeth. If there is a problem like a discrepancy with the height of the gums, we have the ability to treat that, you know, with the laser.
So it's more than just teeth, obviously.
That's right. Okay. Once we get all of those issues in line, and we know, I've helped to guide the patient so they know what they want.
Okay.
Then what we're going to do is we're going to start off by getting some impressions taken. We're going to get it, you know, if they say, Dr. Krauss, I'm ready to go, let's do it.
Yeah.
Okay. All right. So we're going to get some impressions. This way the lab can help us design those teeth ahead of time on a model. Okay?
So then they look at them.
They can look at it and say, yep, that's what I want. That is actually the basis from what the temporaries will then be made from. Okay? And that's really critical. That's
so temporaries, tell me about that.
Okay.
So they get a set of teeth before they get the final veneers.
That's right. So before we've even touched their teeth, they've decided what they want, how they're going to look.
They've seen it now.
They've seen models of it, how it's going to look, and they've had a chance to approve it, disapprove, make the changes, whatever. When we actually do, the day that we do the work, we're going to put something on their teeth that look good.
So is it, I mean,
and that is where the word temporary.
So they get temporary teeth.
They get
that
temporary
are going to look
teeth.
Exactly like the.
They're going to look, yes, they look like the porcelains. Now,
can they eat with them and chew with them?
That's right. They can eat with them and chew with them.
So they see themselves in the mirror. What do they say?
I have one patient. We did temporaries for her, and we were trying to get everything done so she could go to her daughter's wedding. Completely happy with her temporaries. She felt completely comfortable going to the wedding with the temporaries that we had in place. So,
all right.
So now that right there speaks for itself. You know,
so they look good. They look
good. You know, they look and they are supposed to fill that role of enhancing your smile immediately, and so you can start right away feeling better about your smile. But they serve another role too, Randy, and this is if there are modifications that need to be made, if there are changes. We try as best we can when we make a temporary to get the shade, you know, as close to what, you know, we talked about, and the shape. If changes or modifications need to be made, that's a perfect time to do it. While they're wearing those temporary veneers or crowns, that's the time then
to make
we can make any adjustments. Or,
what do they usually say? Do they usually say, I love it? I mean, did they say that?
Yeah. Yeah, they love it.
Okay.
This is what you've talked about. You're delivering, you know, what you've told them you're going to deliver. And yeah, immediately, you know, as soon as they get the temporaries, I mean, you can tell when they're like looking in the mirror.
They're happy.
And they're smiling, and you know.
They ever get choked up?
Oh yes, very emotional.
Is that right? Now, this term instant orthodontics. I mean, somebody with crooked teeth, the right candidate could go in and within a month, perfectly straight teeth.
Yes.
Is that right?
That's
With
absolutely
veneers?
right.
Okay. Does that happen?
Yes, it happens. It happens all the time, every day.
Okay.
You take an individual, they don't want to go through a scenario of you know, wearing braces for another year,
Or
18 months, or
Invisalign or
whatever. Okay, they don't want to go down that road. And usually, to tell you the truth, a lot of times those same people, there's other issues too. Okay, when you do the braces, you're straightening the teeth. Now, there's usually other things that go along with that, but yes, what I mean by that is that the shade, the orthodontics only addresses getting the teeth in a better, you know, position.
Okay.
It doesn't do anything about changing the shade, and most of the time, especially your older adult patients, you know, they're going to have flaws and other issues, and so you're able to deliver.
So you give them a young smile back, in a way.
You give them a young smile back, and you can get it quickly, and today with today's materials and techniques, something that is going to last them a long
Do
time.
they fall off, by the way? It seems like I'd be afraid they were going to fall off if I bite into
Veneers?
Yeah.
No.
I mean, they're strong, like teeth.
The way I do them and the way they're done when they're right, the veneer is a part of the tooth.
Okay. Now the veneer is made out of porcelain, which is
It's made out of
glass.
porcelain.
So it doesn't stain for the most part.
No, it doesn't stain. We need to take care of them just like we would our natural teeth, just
Brush
because.
them and floss them and everything else.
Yeah, and the thing is that any kind of restoration like that, you know, you need to take care of just like your teeth, and it is considered to be part of
Now,
your
is
teeth.
it painful, by the way?
You know,
Because there's people that are watching this that probably the only reason they're not doing something is this fear of pain.
that doesn't seem to be an issue. In other words,
So they don't complain about it a lot. Pain.
no, and you know, another thing is, I'll ask the patient, said, you know, after we were done, like with that session, you know, the big session, how was it? Was it like you thought it was going to be? And without exception, everyone says, you know what, that wasn't anything like I was expecting it to be.
Now, you say people do this for special occasions. Something happens, some event in their life, and they want to change their smile.
Without a doubt. Well, we'll find out right from the beginning. You know, my daughter's getting married, or I'm getting married, or they've got, you know, a big class reunion, or some sort of event in their life that
Going
now,
through a divorce, maybe.
Going through a divorce, something that they've had in the back of their mind for a long time. They want to do something about it. Now something has come up in their life, and you wouldn't believe how many times I've heard that. Okay. And what we'll do is we'll actually say, okay, when is this supposed to happen? I've got a patient right now who's going to go on a big vacation to Maui or something like that, and they want their teeth to be in place before
How
they
soon
go
can
on
it
vacation.
happen? Somebody watching this, and we are out of time. Somebody watching this in an ideal situation, healthy person, they don't like their teeth. What's the turnaround?
2 weeks.
2 weeks, really? Is
2
that
weeks.
right?
I can do it. Yes, we can do it in 2 weeks. Sometimes, you know, in some circumstances, maybe a little faster, but it can happen pretty fast. You've got to come in for a consultation. We've got to see your case and look at everything, you know, before we can like tell you definitively I can do it in 2 weeks. But the turnaround's pretty fast.
Okay, great. Well, I want to thank you so much for coming on the show. Final message. Again, somebody just not happy with their smile. Just come in for a consult. Know your options.
If you're unhappy with things, things are not going to get better on their own. Okay? Okay? People like myself who love what they do have the power to do something for you. Come in, get a consultation. It's not going to hurt to at least find out what your options are.
All right.
You know, and go from there. But if you don't do anything, nothing is ever going to change.
All right. Thank you so much.
Thank you.
Good stuff. Good stuff. The Hot Cosmetic Dentist in Bakersfield.
All right.
Is that right?
With emphasis on the hot.
Okay.
Since that's Bakersfield. Right?
All right. All right. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online or direct a friend to it, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.